Cough. Definition: a sudden and variable expiratory thrust of air from the lungs through the air passages associated with phonation, which momentarily interrupts the physiological pattern of breathing. Mechanism of cough production: cough reflex initiated by chemical, mechanical stimuli. This is carried by the afferents, which are type C and type 1 fibers and innervate pharynx, larynx, large airways, terminal bronchiole and lung parenchyma. Afferents travel via vagus and superior laryngeal nerve. Nucleus tractus solitarius in brainstem is the cough center. Efferents travel via vagus, phrenic, spinal motor nerves to the larynx, trachea, bronchi, diaphragm producing cough. Mechanical events during cough production. The mechanical events involved in a typical cough are rapid successions of a fairly deep initial inspiration, the tight closure of the glottis, reinforced by the supraglottic structures, the quick and forceful contraction of the expiratory muscles, the sudden opening of the glottis while the contraction of the expiratory muscles continues. Classification based on etiology. The etiology can be classified into respiratory causes and non-respiratory causes. Based on duration of cough, cough has been classified into acute, subacute, and chronic. Box 3C1, chronic cough with normal chest X-ray. Cough variant: asthma, tropical eosinophilia, upper airway cough syndrome, aspiration, habitual cough, foreign body drugs, angiotensin converting enzyme inhibitors, chronic bronchitis, chronic idiopathic cough. Based on expectoration, it is also classified into productive or dry cough depending on the presence or absence of expectoration, respectively. Classification of cough based on etiology. Cough duration. Respiratory causes. Non-respiratory causes. Acute cough. Less than 3 weeks, tracheobronchitis, bronchopneumonia, viral pneumonia, acute on chronic bronchitis, pulmonary embolism, sudden onset, bronchial asthma, asthmatic bronchitis, whooping cough, foreign body. LVF GERD. Subacute cough. 3 to 8 weeks. Tuberculosis, pneumonia B, pertussis, bronchiectasis, postviral tussive syndrome. GERD, Tourette's syndrome, intentional cough. Chronic cough. Lasting for more than 8 weeks. COPD, asthma, ILD, tuberculosis, lung cancer, pneumoconiosis, mesothelioma of lung, upper airway cough syndrome. Drug-induced habit cough syndrome. Chronic cigarette smoking is the most common cause of chronic cough. Table 3C2, different types of cough. Types. Features: dry corporal disorders, diseases of interstitium, mediastinal lesions. Productive cough. Suppurative lung disease, airway diseases. Brassy, gander cough. Metallic sound due to compression of trachea by intrathoracic space-occupying lesions or aortic aneurysms. Also known as leopard's growl, bovine cough, loss of expulsive nature as in a tumor pressing on the recurrent laryngeal nerve. Paroxysmal cough. Whooping cough, chronic bronchitis, foreign body, bronchial asthma. Barking cough, involvement of epiglottis, croup, hysteria. Spluttering cough. Tracheoesophageal fistula, cough while swallowing. Hacking cough, heavy smokers, chronic pharyngitis or laryngitis, otogenic cough due to stimulation of Arnold's nerve in the external auditory meatus. Expectoration, sputum. Sputum can be described under the following headings: quantity, quality, odor. Quantity. Normal. 10-15 milliliters, 24-hour bronchory. Production of more than 100 milliliters per day, bronchiectasis, lung abscess, bronchoalveolar carcinoma, organophosphorus poisoning. Quality, mucoid. Chronic bronchitis, bronchial asthma, mucopurulent. Infections, purulent. Lung abscess, bronchiectasis. Rust-colored purulent sputum. Pneumococcal pneumonia. Currant jelly and sticky sputum. Klebsiella pneumoniae. Blood-tinged foamy sputum. Pulmonary edema. Greenish. Pseudomonas granules. Yellow, black actinomycosis anchovy sauce ambic abscess rupturing into lung. Black carbon particles discolor the sputum gray or black. Odor foul-smelling sputum anaerobic infection seen in lung abscess, bronchiectasis. Special points chronic expectoration of large amounts of purulent and foul-smelling sputum is strongly suggestive of bronchiectasis. Sudden production of such sputum in a febrile patient indicates a lung abscess. Table 3C3, Causes of hemoptysis. Structure involved. Common causes. Uncommon causes. Bronchial disease. Bronchial carcinoma, bronchiectasis, acute and chronic bronchitis, bronchial adenoma, foreign body. Parenchymal disease of lung. Pulmonary tuberculosis, lung abscess, pneumonia, fungal infections, pulmonary contusion, laceration. Parasites, trauma, actinomycosis, mycetoma. Vascular diseases of the lung. Pulmonary infarction. Goodpasture's syndrome, polyarteritis nodosa, idiopathic pulmonary hemosiderosis, primary pulmonary hypertension. Cardiovascular disease. Acute left ventricular failure. Mitral stenosis, aortic aneurysm, pulmonary thromboembolism. Hematological disorders. Leukemia, hemophilia, anticoagulants, hemorrhagic diathesis. Three-layer sputum consisting of a foamy upper layer, mucus middle layer, and viscous purulent bottom layer is pathognomonic of bronchiectasis. Postural variation in sputum, bronchiectasis, lung abscess. A. Definition. Hemoptysis is defined as coughing of blood originating from below the vocal cords. Hemoptysis can range from blood streaking of sputum to the presence of gross blood in the absence of any accompanying sputum. The different causes of hemoptysis are given in Table 3C3. The clinical clues of hemoptysis. Differences between true and false hemoptysis and differences between hemoptysis and hemoptysis are described in Table 3C4 to Table 3C6, respectively. Table 3C4. Clinical clues of hemoptysis. Clinical clues. Suggested diagnosis: anticoagulant use. Medication effect: coagulation disorder. Tobacco use. Acute bronchitis, chronic bronchitis, pneumonia, lung cancer. Dyspnea on exertion, fatigue, orthopnea, paroxysmal nocturnal dyspnea, frothy pink sputum. Congestive heart failure, left ventricular failure. And mitral stenosis. Fever, productive cough. Upper respiratory tract infection, acute bronchitis, pneumonia, lung abscess. History of cancer. Endobronchial metastasis from carcinoma. History of chronic lung disease, recurrent lower respiratory tract infection, cough with copious purulent sputum. Bronchiectasis, lung abscess. Pleuritic chest pain, calf tenderness. Pulmonary embolism or infarction, toxic symptoms. Tuberculosis. Weight loss. Emphysema, lung cancer, tuberculosis, bronchiectasis, lung abscess. Melena, alcoholism, chronic use of nonsteroidal anti-inflammatory drugs. Gastritis, gastric or peptic ulcer, esophageal varices. Association with menses. Catamenial hemoptysis, cachexia, clubbing, hoarseness. Lung cancer, small cell carcinoma. Filled square, filled square, filled square, filled square, filled square. Clubbing. Lung cancer, bronchiectasis, lung abscess, dullness to percussion, fever, crepitations. Pneumonia. Table 3C5. Differences between true and false hemoptysis. True hemoptysis. False hemoptysis below vocal cords. Above vocal cords persists as blood-tinged sputum. Does not persist, may be mixed with sputum. Not mixed with sputum. History of cardiopulmonary disease. Table 3C6. Differences between hemoptysis and hemoptysis. Hemoptysis. Hemoptysis, coughing of blood. Cough precedes hemoptysis. Vomiting of blood. Nausea and vomiting precedes hemoptysis. History of cardiopulmonary disease. History of gastrointestinal disease. Bright red in color. Dark brown in color. Sputum remains blood-stained after the attack for few days, usually followed by melena mixed with sputum. Mixed with gastric contents, blood is frothy due to admixture of air. Airless and not frothy, alkaline. Acidic sputum contains hemosiderin-laden macrophages. No melena absent. Melena present. Massive hemoptysis. Life-threatening massive hemoptysis is defined as coughing of blood greater than 150 milliliters, episode greater than 600 milliliters, 24-hour. Only 5% of hemoptysis is massive, but mortality is 80%. Clinical definition of massive hemoptysis is any bleeding that results in a threat to life because of airway or hemodynamic compromise due to bleeding.